yes, we have brought to you a very, very crucial and interesting topic as well, and this has to do with myopia. As we know, that will be the focus for today, and we are shifting our attention to the main discuss. Well, we'll take a quick breather, and when we return, we'll dive straight to main points of view. Be right back. As we know, our eyes are often described as one of the most valuable organs of the human body. And when we say valuable, a very, very sensitive part of the human body. And most of the times you hear questions about when you check your body, you should check every area of the body, every aspect, including an eyes. But sometimes we tend to neglect the important part of what gives us the vision, gives us the light and inability for us to see better and, of course, go about with our daily activities. But this is why we have doctors bringing crucial information and important discourse every day every Thursday on the issues program, just to throw more light and get us to understand how important our health is and how crucial are some of the sensitive organs of our body that we tend to neglect. Like I rightly said, this is the issues, and you are definitely welcome on board. We also gave opportunities for you to call in, ask questions. We have doctors in the house, so we'll definitely give justice to the conversation. And then if you have any question for them, you can easily call us once the phone lines are read, and then she would do justice to your questions, giving you response to it. Dr. Oluwabukola Aroshegbe, and she would be throwing more light and making us to understand what myopia is all about. Well, first thing first, Doctor, when you told me about the topic, I said something that it's really interesting because not everyone would understand what is myopia at the first place, not to talk more of what it is all about. But luckily we have you in the house with us to give us that good understanding. So let's kickstart the issues. What is myopia?
So myopia, in a layman language, they call it short-sightedness. That's another name for it. Then it's one of the refractive error that a lot of people suffer for. But in these present generations, we have it more in children because a lot of them do near walks, watch cartoons and all that. So myopia is a situation whereby the object you're looking at is not falling on the retina. Like the light passing through the eye isn't falling on the retina. So in this condition, people that have myopia, they tend to see things that are close to them, but they don't see things that are far away from them. And then the people don't really detect it early, or we parents, and then I think teachers do some justice to it now by calling parents' attention to their children that their children isn't seeing things from the board until they move close to it. But we parents used to ignore it a lot because of the myth that anybody that wears glasses, their eyes will go in. So people don't want their children to wear glasses. So early detection is very good for this condition. Okay. Like what I said earlier, for parents to detect it at home, you see your child going close to the TV. When they are reading, they bring their books close to the eyes, and then what again? I think. So for that's aside, and also another thing is that in school too, parents and teachers tend to call the attention of their parents, and parents will now bring them to the hospital for us to examine. That's when we detect, and it's good to do and detect it early, like from age 2. Yes, they might not respond well to us when we are doing the test, but we have a way of dealing or tackling to get a result from the children. Okay. It's good to detect it very early, from age 2. They must have known some things about ABC, so we can do the test with that. So from age 2 and above, and the earlier the better, because from age 2 to like 8, they are still growing. The eyes is still forming. When you introduce glasses early to them, it can help correct in the sense that it doesn't go worse than what it is before. Okay. Or the prescription, if it was an high prescription, it will not make it go higher than that. And we have a condition we call asthenopia, in the sense that when they outgrow we call it emetropization stage. Okay. When you introduce glasses, it might not give them the optimum vision anymore, with or without the glasses. So the earlier you introduce a correction to them, the better.
And Dr. rightly said that I can relatively understand what you're saying. As someone who wears glasses and has always been with the glasses, I know that some people, like how my parents detected, it was based on I always squint the eyes each time, and then there's this tearing part of the eyes. But one thing also is that sometimes there have always been this misconception, when a eyes is teary and then a child is squinting. Sometimes we take them to the hospital, or maybe a parent who doesn't even know anything about it might just think that that child has allergies, and then they start administering self medication to that child. Something them themselves feels that is an allergy. Now, as a doctor, I need you to differentiate what an allergy means, and then how can we differentiate when a child really has an eye problem different from just an allergy.
It depends on the presentation. For allergy to occur, apart from the teary eye, you need to be itching.
Okay.
That you are irritated by something. So the itching comes in. When you itch, there will be redness. With myopia, apart from the fact you're squinting because you're trying to focus on. If you're like when you're rested like this, your eyes is rested, you're looking straight ahead. The vision isn't falling on the retina.
Okay.
So because it's not falling on the retina, the vision is blur. When you squint, it's like you trying to force your eye to see. So making it fall on the retina, you cannot squint for long. The squinting is like you're stressing the eye. Why the eye is meant to be at rest.
Okay.
You are putting more effort on it. And it's like you a rubber band.
Okay.
When you stretch it for a long time, it breaks. The breaking is when you see the tears. So it's a way of the eyes telling you that I'm tired.
Okay.
So now, about the parents getting the proper care is, in the olden days, or when we were growing up, there wasn't this awareness. Most of the time when a child complains like that, we take them to the general physician, not to an optometrist.
Okay.
Or you take them to an optician. And there is difference between optometrist and optician. Opticians are the ones that will glaze it. We are the optometrists are the one that will examine and give you the proper care. So that's where we miss it. Okay. So when you take them to a general physician or optician like that, they might just prescribe a medication for you without doing an in-depth test for the child. Okay. So we miss it there. That's why it's later in life. Maybe when the child is of age, we take him or herself to an hospital to see an eye doctor, which is the optometrist, or maybe from conversation relating with other children or other people. That's when they get to know what is really wrong with them and do a further checkup for themselves.
Okay. Now, going on with the conversation, still on the eye check and all that, you did mention about correction, and which you said is very important for an early detection so that the eyes can be corrected. Now, we know growing up, there's sometimes even when a child is given glasses, then the parent tends to ask questions like, at what duration, like what period is this child supposed to wear the glasses? And that's the first question. Now, the second is how though the parent or whoever, the one in charge of the child, or even a person, an adult, can know that, okay, this side is corrected. That is the second question. So I'm asking like a 3-in-1 question, so just hold on. And then the third also is, even knowing fully well that your sight has been corrected, does it mean that the child or whoever, the individual wearing these glasses, has that tendency to drop the glasses? Or are there further treatments that has to go on, just to ensure that whatever experience they're having before do not come back?
So I'm going to start with the third question.
Okay.
So for the third question, you said when the period they will use the glasses and when to drop it. So it depends on the power of your glasses.
Okay.
We have the simple myopia, the middle, and the maximum of it. Okay. So it depends on the power of your glasses. For the simple myopia, it's a little. That's why I said when you detect it early, as they are growing, it's like you introducing a message to the brain. This is how you should see. You shouldn't see less than this. Okay. As the brain is growing and receiving a constant message every day, there is possibility of the child outgrowing the glasses. I said possibility. Possibility. Yes, it depends on how the child is growing. So for some children that have a rapid growth, there's possibility of their power increasing or reducing because of accumulation of water. what gives our eyes this shape is the water content in it. That's the aqueous humor and the vitreous humor. So as you are getting fatter everywhere adds up. So it's possible it affects your vision. So for when to drop their glasses, it all depends. They are the one wearing it. So it's them. Oh, I got these glasses this year. The following year, it's not as clear as it used to be. When you go for your regular checkup and they check, you've outgrown these glasses. You don't need it, or you need a lesser power. So it's a regular checkup. When you go for a regular checkup, that's when you will detect it. For children that are still little, within age 2 to 10, I'll put it that way, we actually recommend, depending on the severity of their refractive error, we recommend 6 months or 1 year check.
Okay.
Yes. So that we can monitor. And then when we see irregularity in it, we can reduce it to when the child or when the patient complains of the vision isn't clear again with the glasses.
Okay.
Yes.
Okay.
Then the second question, sorry, I didn't get that.
The individual notice that probably they can see without the glasses. Is it advisable for them to drop the glasses, or do they need further treatment even while they had dropped the glasses? And how do they even know that truly the sight is corrected?
They can, yes, the vision can be better. Along the line as they are growing, the vision can be better without the glasses.
Okay.
But they might still need, even if it's a minute correction.
Okay.
So they need to visit
Often.
Okay. A 1 year or 2 years maximum. For most of our patients, we tell them 2 years maximum. But within that 1 year, if you notice a change, you can always visit back.
Okay.
For us to know if you can do without it or not. Because I hear a lot of our patients come in and saying they could see better with their eyes, so they dropped their glasses.
Okay.
And along the line, it get worse.
Okay, the reason why it gets worse is because they don't often come back for a checkup, or maybe there are some medication they were supposed to continue, and probably they don't even have an idea. You just throw more light
For
on that.
myopia, it depends on the type of myopia.
Okay.
I forgot to mention that we have the congenital myopia, we have the developmental myopia, and we have progressive myopia.
Okay.
For the congenital myopia, like we have some parent that wears glasses, and when they give birth, along the line, their child too picks up. So they inherited it from their parents. We have developmental because of as they are growing. Children of these days, they do a lot of near work. They are either on the screen or they are reading their books. They are indoor. That's another thing that induces myopia. Being indoor a lot. When we are growing up, we go from one neighbor's house to the other. We play around and all that. So we are when you are looking at things afar, it's like the eyes is at rest, doing his work. But when you do near work, the eyes is converging. You are putting it to work with continuous convergence. It's a signal to the brain so that, okay, this is the major thing we are looking at. But then when they are looking afar, there's an issue or slight issue. So because the world is going digital, so everybody is yes. So that can induce myopia.
Okay.
Well, the research is still going on, which is not yet concluded.
Okay.
Yes. Then we have the progressive myopia. For those that have very high myopia, like more than 6 diameter, there is a way along the line. It can not certain, but there is possibility of it growing for some people that have progressive myopia. Like you come this year, it's 6 diopter. Next year, maybe 6.5 or 7. And the way the diopter is increasing, the shape of the eye too is increasing. Like for myopes now, when you see them, you see most of them have their eyes are a bit big, like bulging, like that. But it's not all bulgy eye that is myopia. Yes. So their eyes are a bit bulgy. Then the myopia, for progressive myopia, the eyes keep increasing, and we have other layers in the eyes that it affects. It affects the retina. Like as it's increasing, you will see the retina maybe is expanding, and along the line when it's expanding, there will be a tear. Maybe it's affecting the retina, it's affecting the choroid, like that. So that is progressive myopia. Yes. So when and it can, for people that have myopia, they tend to have depending on the degree, they tend to be more exposed to have glaucoma. Yes. So if you don't do a continuous check, how would you know? So you need to check. Even if you don't have any refractive error, just put it as part of a medical check for a year. Check your eye. It saves a lot.
And I know that this is very, very common in Nigeria, where they'll say, oh, do not allow the child to wear glasses, or don't start wearing glasses, because if you start, you continue that way, and some will even tell you that you might not end up seeing again. Just like you said before, that your eyes will go inside. These I've heard it over and over again, and they'll be like, oh, because you started wearing it and now you're not used to it and you can drop it. Please, how do we correct these notions?
Okay. Because it's appreciating life. You don't expect such a person to drop it. So the notion of, oh, you've worn glasses before, you will continue to wear it. We are all different.
Okay.
I can be born without using glasses. Another person can be born that you must wear your glasses continuously. So because I'm not using glasses, I shouldn't judge the person that is wearing glasses, because that is what the person is using to see. So they should remove that myth of, if you wear glasses, you'll continue to wear it. Do you know why the person is wearing it? If the person removes it, because I see a lot of parents depriving their children that opportunity of seeing good. And when a child doesn't do well in school, you beat the child. Meanwhile, it's not the child's fault. Or teachers scream, beat the child. It's not their fault. And through that, you are introducing fear into them, which is something you could ignore. Even these days, glasses is like fashion to people.
True. Okay, now let's talk about hot flashes. I've seen complaints before when someone says that each time they close their eyes, or sometimes they open it, they tend to see this hot flashes of light. It's like someone flashing a light inside your eyes. But then again, that might not even be in a lightened environment, or an environment where maybe there's a bulb or something. What causes that?
So a lot of things can cause flashes of light. One, if you have cataracts, depending on the type of cataract you have, it causes, because it depends on the position, it causes scattering of light. So they might feel the flashes of light. So if you have a retinal detachment too, it can cause, you can experience the flashes of light. So a lot of things can.
Okay, can you explain the cataract and then the retina so that we'll understand better, please?
So for the cataract, it's opacity of the lens.
Okay.
So the lens, like when we are seeing, the light passes through. I might use some terms that might not be, people might not be conversant with, but I'll try as possible. So the light passes through the cornea. The cornea is a transparent part that is on top of the black part on our eyes that you see. So after passing through the cornea, it passes through the lens. The lens is inside the eyes. Then from the lens through the vitreous to the retina. So the retina is from the retina that the message is being passed to the brain that interprets whatever you are seeing. Yes. So when the lens is opaque, the rays of light is not passing through to the back. So you see some people, when they have cataract, get to a point they are not seeing well with they are not seeing with the eye, because like the window of the eye. And it depends on when the cataract starts early, like the early stage of the cataract, because it hasn't really formed. Depending on the type of cataract the person has, it might scatter light. So when the light is like hitting different block, if it's in different okay, let's make an example. Your window at home got broken, then you use tape to tape up some part. You know, when light is passing through, it doesn't go straight, it scatters. That is how it is. For cataract. Then for the retina, I told you retina is where the image drops, and from the retina it passes down to the brain. So it's like a board. If this place is bad, if a part is bad, when light stays there, scatter off. That's
wow. Okay, for someone who is experiencing such flashes, what advice would you give? And mostly if this person is already on someone who is wearing glasses already having an eye problem and all that, then experiencing this, what is the next step?
We have some people that are sensitive to light, generally. So most of the time we recommend them getting a coated lenses, like photochromic or getting a blue cut lenses. For somebody that is wearing glasses before, we can recommend that, with your prescription, we can give you something in addition to it. We can make it a photochromic lens or a blue cut lenses so that it can break the rays of light. Like instead of, yes, you will see, but instead of the direct ray of light entering your eyes, there's something protecting you from it. That aside. Another, for those people that it's pathological, because this cataract and retina this thing is pathological, it's not a refractive case. So that's why they really need to visit an eye clinic or visit an eye hospital to really know what is really wrong with them and treat it accordingly. So we cannot just say without examination.
Okay. Dr. Oluwabukola Aroshegbe doing justice to the conversation on health thoughts. And today is all about myopia, having a good understanding of what myopia is all about, as we rightly know that what appears to be a minor challenge may eventually affect learning, productivity, and even workplace performance and road safety. And this is why it's important for you to know everything that has to do with your eyes as well as every part of the body. And this is the conversation this morning. You can rightly be part of it by calling us on 0904082161 or 0904081161. If you have any question for our doctor, she would be glad to take your submission. You can also leave us a message on WhatsApp 0904081161. We'll read out the message as well. You can also drop your questions there while we respond to it as the conversation is ongoing. Now, doctor, let's go back to the conversation. Rightly, you'll be doing justice, I must say, to it, but let's throw more lights and understanding to the topic of discourse. Now we're still discussing about myopia, and that has to do with the eyes and all of it. I'm so glad that you have cleared some of those myths that most people are always, scared of when it comes to wearing of glasses and all that. Now, you raised a very important part when you said that it is always good for you to include your eye checkup as part of every other checkup in the body. Now, some people I've known, and I know that you know what I'm about to say, believe in trado-med. And I will tell you whatever it is that a doctor can do, we can easily do that through trado medicines as well. And I've seen cases even on social media where they'll tell you mix onion or mix this, blend it and turn it to an eye drop and you put on the eyes will become clear. I've seen even someone saying when you use your morning pee, you can also use it on all of that. Do you think all this is necessary? What would you say about all of those trado medicines?
We haven't done research on things that have been shown on this social media.
Okay.
And people are buying their idea because it's cheaper. So they go for something cheap. Like where I was working before I came to General Hospital. It was a private hospital. We had a patient that had glaucoma.
Okay.
And then the patient's vision was like 20%. And we advised this patient to continue using the anti-glaucoma drugs.
Okay.
But he complained that it was expensive. And he came back one of these days and said he's not seeing well again. What have you been doing for over 3 months? You didn't come for your checkup. He said somebody on the radio station said he should use so thing and use this and use that. He did use it, but he still lost his vision. So most of these things on the social media, I wouldn't advise people to follow it up because it has not been guaranteed. We are all just looking for a way to make money. They are looking for a way to make money. I read something up yesterday too about a man that they said he should do cataract surgery, but he said he saw something on social media that he should get the glasses, that the glasses will clear the cataracts. He did get the glasses, and the cataract did not go off. He came back to the hospital. The doctor now asked him, "Why are you using a sunshade?" They sold a sunshade for him. So most of these things, even inside red buses, I hear them advertising this medication. One medication will clear glaucoma. One medication, same medication will clear cataract. Same medication will clear you from using glasses. And these things you are mentioning, because that's one thing I ask myself, and as human that we are, and learned that we are, how can one medication cure one thing? One thing, and this thing, one medication cure a lot of things. And there's a lot of things that we are talking about. Cataract has its own pathway. And glaucoma is a different pathway. Then being a refractive, the refractive section part of the eye is a different pathway. How can one medication join these three things together and cure? How?
Right.
So those are the things. As human, you should question some things people put out to you. So I wouldn't buy the idea of this herbal medicine and all that. I wouldn't buy it. The only one I think they are still working on, I haven't, or people are using, but they said it helps reduce eye pressure a bit. I don't want to mention the medicine because people will go and buy it.
Because yes,
So
I don't want to give publicity.
yes. So I wouldn't want to mention just one.
Okay.
So I won't mention the medication. So, but people should try and do a proper check.
Okay.
You don't just conclude. And the idea of, oh, so person used so medication and it worked for the person. You now want to pick that same medicine. Do you know what the person used that medicine to treat?
Right.
So we shouldn't. Just, I know the way the country is going is, but we can always do better. General Hospital is a good place.
Doing an eye checkup, is it that very expensive? Maybe you should let us know. Probably that would be the fear. Okay. What are the processes?
Okay,
please?
yeah, if for private are actually expensive, you can always come to General. We will surely attend to you
Okay.
properly. So it's not expensive. It depends on what you're managing, the
Okay.
condition you're managing, but it's not expensive.
Okay, so run us through the process. Who are they supposed to see first? A consultant, what and what, so that everyone will just have
So
the understanding.
for when you come, I will use General Hospital as an example.
Yes.
When you come, maybe most of the time they tell them to go to GOPD. Maybe they start from GOPD. Those that don't really know.
What's wrong?
Yes, they, from GOPD they complain because we have some patient that complains of headaches. Eye problem can give you headaches. So once they run their distance, it's not relating to, they refer them to eye section.
Okay.
Then for those that really know that okay, it's the eye that is wrong with them, we have a section where they come to eye section. Then they triage them, know what's really wrong with them, to know the section, because at General Hospital there we have the ophthalmologist,
Okay.
we have the optometrist, we have the ophthalmic nurse. So we have them, and we know for each patient we will know where to send them to for proper treatment.
Okay. Some people believe that once a child is born, you should use something like a black eye pencil or something on the child, for a proper vision. Please, let's also get your thoughts on that.
I know a lot of people. I see.
Curious about
Yes,
it.
I know a lot of people. They said it removed the dirt from the eye. I don't know the dirt they are looking for in a baby's eye. So I really,
Okay.
to me, and so far there's no relationship between the black eye pencil and.
But isn't that dangerous too?
It is. You can introduce infection to your child's eye with that, because you are repeating the same thing, and it might not be just the child that is using it.
Okay.
The parents too might be using it. So you're introducing different things. The child can pick up infection from that. So what advice?
Okay. All right. Let's go straight to WhatsApp to see some of the messages. We have Mrs. Fumalayo from Ikorodu. Good morning, doctor. Good morning, Gift. Well done. My 10-year-old son always moves very close to the television before watching. We have warned him several times, but he keeps doing it. Could this be a sign of an eye problem? An eye problem. Maybe that's the reason it goes closer to the TV screen.
Yes, it might be a sign
Okay.
for them. So they should try and take him to an eye clinic or an eye hospital. So it might be myopia, it might be any other thing. So it's good to just check early. It's 10 already, so they should help.
All right. Mr. Chinedu also from Ibuti. Well done, IKDFM. Doctor, can excessive use of phones and laptops actually damage the eyes permanently? As you have said, screening is bad, or is it just a temporary strain?
A lot, or on the phone a lot, just like what I've said earlier. You're doing a lot of near work. So for the eye, is used to that. And when we do a lot of screen work, we blink less. So at the end of the day, the way we produce tears is not the way we should produce tears.
Okay.
Is not the same as somebody that works on the system for more than 8 hours in a day. Because you blink less, there's no proper production of tears. So you can have things that can come with screen use. Is dry eye.
Okay.
Okay.
So it's very important to blink.
Yes.
Because,
So for people that work
to
on the
blink often.
system, yes, we always give them these rules of 20, 20, 20. So for every 20 minutes, you look at something 20 feet away from you. You
Okay.
blink for 20 seconds. So it helps reproduce tears. And the tears is to lubricate the eye. Because along the line, you might start feeling redness or gritting sensation. Like something like is in the eye, but really nothing is there.
Okay, let's go to get more of those questions. Aisha Bello, good morning. I have been wearing glasses for almost 7 years now. Does wearing these glasses makes the eye become weaker? Because I feel my eyes are getting weaker.
No, the wearing glasses does not make your eyes weak. It's aiding the eyes to see better. When you remove it, you feel it's weak because when you remove your glasses, you are not seeing. But the glasses is to help you. Because if you remove, you are not seeing. That is you. So it's not that the eyes is weaker. It's just telling you, it's just a clear difference between the glasses and you. And your brain telling you that, please put my glasses back for me to see better. Yes.
Okay, in such circumstances, is it advisable probably for the person to always be with the glasses, maybe except they want to sleep?
Yes.
Okay.
For proper view, for proper appreciation of the word or whatever you are doing, put on your glasses every time.
Okay, so apart from
when you want to sleep or you want to have your bath.
Okay, so there are no other probably tendency that could have caused the eyes to be weak, apart from the eyes trying to acknowledge that there are no glasses.
That's why I said in eye section, we have the refractive part, we have the pathological part. We have people that have both refractive and pathological. So we manage the pathological part with medication.
Okay.
But if it's strictly refractive, we manage it with glasses.
Well done. Okay, let's go further. Mrs. Olumide Johnson, IKD Ajisheo, is myopia hereditary? And if both parents wear glasses, does it automatically mean every children will have the condition?
It doesn't automatically mean that. So that's why we say we have recessive gene and the dominant gene. If the child inherits the dominant gene, which is wearing of glasses, there is possibility, it's 100% that the child will wear. But if it's recessive in the child, it means that the child might not wear, but there's possibility of the child passing it to the next generation. So for a parent that wears glasses, it doesn't guarantee that when you give birth, your child must wear, but there is possibility of. It's just like the X and Y chromosome. When you try to match it, this one XX or X and Y. When you match it, there will be XX, there will be XY. There will depend. That's how it is. There's possibility of the child wearing, and there's possibility of the child not wearing.
Okay. Now, let's move on with the conversation. Then we'll get back on the message. I know there are healthy living, which is very, very important, and doctors like you will always encourage healthy living. Now, on the aspects of maintaining a good sight, what are the lifestyle one can imbibe?
You can take like some fruits that are rich in carotene, like carrots. Then maybe recently I think I read something about onions being good for your eyes too. Then
Eating a lot of onion.
Yes.
Okay.
Then vitamin A, food rich in vitamin, like your vegetable oil. They are very good too in vitamin, and I think palm oil too. So eating healthy, just balance your diet.
So doctor.
Then also for people that have BP, there's hypertension and diabetes, they have a way of affecting the eyes too. So that's why I said eating healthy. So if that's all these things are in good regulation, you should be good with it.
Okay, Dr. Luabukola, I want to call you out on this one. Doctors like you always advise that reduce your oil intake and all of that. And you just mentioned vegetable oil.
For children that are growing up, it's good for them.
Okay.
Because that's why they included it. Even if you read this thing, they'll put draw I and put A there. So excessive eating of it is not good. Moderate. We should do a moderate eating. It doesn't mean that every morning.
Regular
eating of it.
Okay.
Not excessive eating, not you waking up in the morning and drinking granola for what?
So are there some supplement? Because I do hear people say there's some supplements, attached to. Okay.
Yes,
Okay,
there are
please.
some supplements you can take too,
Okay.
for the eye.
Okay.
So it's more like you taking supplements for immune boost to boost your immune. Same thing for the eye. So we recommend some supplement, but shouldn't be a regular use too.
Okay.
I wouldn't advise that because the liver is the one that processes everything we take in. We shouldn't overwork too.
Okay.
Yes, to me, I wouldn't. Yes, you can take
Advise
if it's not like we have some condition that will tell you to use your supplement constantly, but just
okay.
you just want to take just for your normal this thing. You can take a cup this month, maybe skip, then the next month you can take another cup. Like finish a bottle. That's once daily we take, depending on the type of supplements you're taking.
Okay.
So most of the supplements should be rich in xanthan and then oh, I forgot.
Okay, that's fine, doctor. We understand. Now, moving on, just because I'm concerned, and as a female, I want to talk on behalf of every pregnant woman out there. Building a child, I know there are things that one should put into consideration, and they'll tell you one of it is nutrient and all of that, so that the child can grow healthy. Now, what can a pregnant woman take, intentionally, just to ensure that a child has good eyesight, a child when born?
In terms of pregnancy, a lot happens. A lot happens. So one of the things is try as much as possible to prevent infection, because I get to know that infection has a way of when you're pregnant, the mother should try as much as possible to prevent vaginal infection.
Okay.
Because it has a way of
affecting the eye.
Yes. So that then eat well, eat fruits well, like avocado, because those are the things I did when I was
okay.
Because a lot of fruits, a lot of fruit, especially times that you don't feel like eating anything, just try and take fruits too.
Okay. Now, what about yeast? I used to hear about people saying
yeast doesn't really do anything.
So it doesn't.
It's like a placebo.
Wow. Do you know many women believe that?
Yes. I've heard a lot of them talk about yeast. I have started taking yeast too. It's cleared my. Like to me, it's like a placebo. We don't.
Wow. So many things to learn about, and Dr. Oluwabukola is really doing justice to the conversation, because right here, educated beyond what I know before. But let's quickly go back to the messages. We can't keep people hanging for that long. Now, Ruth Ekanem, she said, Doctor, some people buy glasses from roadside vendors without testing their eyes, and some will tell you they already have the results, so they just give them the glasses to put in lens. What will you say about that? Doctor, some people buy glasses from roadside vendors and without testing their eyes. And they said, and sometimes they know the results and then they just give them to fix the lens. What will you say about that?
For those that without testing, they just go by most of them are presbyopic patients. Like they just want something to help them read.
Okay.
So it's not advisable because at times they give them something higher
as a glass to go
read with.
Yes,
to go read with. And at the end of the day, it gives them headaches. We have some of them coming back to us. I got these glasses by the roadside, but it's not working well for me. They just need the proper eye check. So they come back and do the proper eye check. So my advice to people is to get their eyes checked before they use glasses. Because when you are not using your proper power, it can give you headaches or eye strain. And for those that have their prescription, like we in our organization, we don't advise giving patient their prescription. We do the first pay for them, so that when you take it to the roadside and they don't give you your proper prescription, you won't say the doctor hasn't done his job well. So we advise them, get your glasses from. We did the test, so do your glasses with us, so that when you have any complaint, we can always know how to address it. When you go to the roadside, is it when they've collected your money, you're not going to complain to them? Who will listen to you?
Truly.
Nobody will.
Okay, let's take a few messages also. We have Abdurraham Musa. Good morning, gift well done. Sometimes when I drive at night, the lights from oncoming vehicles appear blurry. Could that be related to myopia, or is it another eye condition?
So if it's strictly while driving at night, it's not myopia.
Okay.
So you might be sensitive to light. We have glasses we recommend for that condition. We have the photochromic, which takes away it bounce. It's more effective for the yellow bulbs light, which that's what most vehicle has.
Yes.
And for those that are really really sensitive to light, we recommend Polaroids. We have
Okay.
another form of protection, Polaroids. Well, that can be of the eye side, but the normal one that everybody can use and cope with is photochromic.
Okay. Throw more lights into the conversation. If you're confused in any aspect or you have a question for Dr. Oluwa Bukola, you can do well to reach out to us via 0904082 1061 or 0904081 1061. And yes, more messages. We will be mighty glad to take your submission on 0904081 1061. Our time is fast spent. It's 47 minutes past the hour of 11. So we'll just pick more few messages, and then, Doctor, you can do the roundoff of the conversation. Mr. Emmanuel Udo, IKD, well done. Can spending more time outside really help children's eyesight? Doctor said that.
Recently, because of too much indoors for children, like what I said, it can induce. It doesn't mean it automatically means that the child will be myopic. It can induce myopia.
Okay.
But playing outside, like what I said earlier too, looking at far, your eyes is relaxed. When you are doing this, your eyes is at work. So just make them relax. It helps a lot. It relaxes not just the eye, it relaxes the body, and it just makes them feel free. Because children of these days, for those children that are inside, once they go out, they're always yes, they don't want to go back inside. So it helps not just the eye, the entire body.
Okay, all right. More messages. Let me see. Tunde from Okolonso. Is eye surgery the only options for treating myopia, or are there other effective methods available, doctor?
So that's why myopia is of different degree. For the progressive myopia, sometimes if glasses doesn't help, we do surgery. And nowadays, there is laser surgery, which is seamless. Makes things much easier.
Okay.
So surgery is not the only thing for myopia. We have glasses. So we have contact lenses too. For those that don't want to wear glasses, we have contact lenses. Nowadays, those days there is contact lens of different colors. And if you don't want people to know that you are wearing a contact lens, we have the transparent. Once you put it on, it looks like your eye.
So these contact lenses are very effective as well as
yes, depending on
glasses.
what it depends on what you are using to treat. We have contact lens for myopia, we have contact lens for hyperopia. We have for some developed some countries, because when I was in school, we did some research on contact lens for presbyopia.
Okay.
So it's functional in some countries, but not. I don't think there is any presently in Nigeria that I'm not. I don't really know about.
Okay.
Then contact lens for depending injury in the eye. So we have bandage contact lens. Contact lens has different use. So it all depends on the condition you're using to manage.
Okay. Now, moving on with the conversation, I know most people were curious as well as me. When we talk about outreach, get the eye tested, Nigerians like free breeze, like they'll say, woof, So is there any kind of clinical outreach that one can easily participate?
Okay, you call it outreach. It's not an in-depth test. Just to examine, come to the hospital. You will still come back to the hospital. Yes, there was a time we do it.
Okay.
So I don't know for now if there is anyone organized presently, but they do. They do outreaches. We've done in the hospital. We've done at this is it Telewa.
Okay.
There was a time they organized there, not just the Telewa, then the hall along the court area. Yes. So
Okay, so even it's advisable even when you
Even with the
okay.
outreach, we can't tackle everything out there. And the resources we are carrying out, like the instruments we are carrying out, is limited.
Okay.
So we won't do a proper examination for you in an outreach. So it's
Okay.
still good you visit the hospital. General hospital is cheap. It's cheap.
Is
Just
the way you're
come.
emphasizing it, the general hospital is
Because I've worked in private sectors and I know how expensive it can be. But here, it's cheap.
okay,
Come
doctor.
and check your
Let me
eye.
put you on the spot on this one. If anyone has any complaint about eye checkup, can they just really go to general hospital and ask for Oluwabukola, Dr. Oluwabukola
They can-
Areshegbe? Yes.
They can come down
Is there a
to
guarantee?
they can come to general hospital
Okay.
to the eye section. Anybody will attend to them.
Okay.
Just meet them. I'm new. I want to check. I want to get my eyes checked. They will attend to you.
Okay. Dr. Oluwabukola, you've really done amazing with the conversation. But before we wrap up and let you leave the studio, please let's get your parting words.
Okay, so just like what we've been saying earlier, I will emphasize more on the children because they are our generation, the next generation coming up. For our parents, please try and pay attention to them. The little things they say means a lot. And mommy, I'm not saying. Try and yes, I know you can be so busy. Everybody's trying to hustle and all that, but little time coming to bringing them to the hospital for a checkup won't like it's like you sowing a seed into their life because a clearer eye is a clearer future. For a child that is not doing well in school and you are beating the child, you are shouting at the child for a long time, the child will withdraw and will just take life the way it is. So for our parents, please, as much as possible, no matter how small your child is, please try and bring them for a follow-up or a checkup in the hospital. Thank you very much.
Okay. Oluwabukola, it's a pleasure. Honestly, like I said, you've done amazingly well with the conversation, and thank you for the enlightenment and understanding. And this is how far we have to go on the issues today on IKD 106.1 FM. We are putting a full stop here for today, but the issues continues tomorrow. Of course, we have genuine conversations right here, and to bring you conversations, analysis beyond the headlines, and have it well dissected on the issues platform. But for today with the health talks, we thank you so much for being part of the conversation. Thank you for your messages. We would also be glad for you to join us next week also as we do the health talks every Thursday 11 a.m. and from Monday to Friday are all the issues right here on the issues platform on IKD 106.1 FM. Like Dr. Luabukola rightly said, a clear eyes is a clear future. So this is my advice to every parent out there. Ensure that you pay attention to your child, and when they keep complaining or complain about a particular problem, mostly eye, please do well to rush them to General Hospital Kurudu. You have amazing doctors to do well with the child. And yes, always remember to be a patriotic citizen of our dear country, Nigeria, nurturing your conscience just by the truth. I'm Gift Abuna. We'll see you on the other side. It's a bye for now.